Hi, so today I'll be speaking on the profession of physical therapy, and this is my infographic as you can see it here from top to bottom. And I'm going to start out by saying what physical therapists typically do. They carry out an individualized plan of care in order to treat injuries that may occur because of either sports or trauma. They maintain and restore physical functioning, possibly in elderly people. They alleviate pain or they prevent physical dysfunction in patients. And the main goal of physical therapists is just to provide the best quality of care and create the best quality of life for our patients that we can. Some of the basic essential knowledge that you must know before becoming a physical therapist is you must have, number one, being customer service, because our first job is interacting with the patients so that we can understand them the best that we can. We also, as physical therapists, must have knowledge in customer service and counseling as well. And so that counseling comes in the aspect that we must connect to our patients on a deeper mental level. If we can understand them mentally, then we can know how to help them physically. We also, as physical therapists, must know about medicine, chronic disease, anatomy, and kinesiology, which will be learned in the Bachelor of Science degree that I'm about to talk about. And we also, as physical therapists, must know how to use technology and documentation because it is very important as a physical therapist to be able to document patient progress on charts or computers. In terms of schooling, physical therapists must first complete a bachelor's degree in science, which typically takes about 4 years. Some examples of this include exercise science majors, biomechanics, or biology. And then after that, you typically have to complete a doctoral degree in physical therapy, which takes about 2 to 3 years, and these programs must be accredited. Also, after this doctoral degree, students can opt into taking about a 1-year residency, which then helps them go into a specialized field of either sports or geriatrics or something else that they might want to go into. In terms of undergraduate experiences on top of the education, physical therapists are typically required to have about 160 hours of internships before getting into DPT school. This is required or recommended to be in a variety of settings, such as clinics, hospitals, sports management facilities, so that way students can get a wide variety of ideas that they might want to be in, and then they can narrow down themselves to a specific field once they get into DPT school. Some of the essential skills of physical therapy are, number one, evaluation skills and just active listening to either their peers or their colleagues, and also being able to question patients so we can understand what's wrong with them and use that to determine the plan of care. We also must be able to use critical thinking skills because physical therapists will tell you that the first plan might not always be the best plan. And you have to kind of think outside the box because each patient is different and these individualized care packages are all different in their own ways. You must also have empathy and social awareness. In terms of characteristics, you must have concern for others because we are in healthcare and we are trying to create the best lives for others that we can. You must have integrity, dependability, and you must be connected to others because in healthcare, we're stronger alone than we are together. In terms of salary, you can see here on the blue chart that in the United States in 2020, the average salary for physical therapists was about $91,000. And then in Georgia, which is the state where I will most likely work once I graduate, the average salary for physical therapists was about $86,950, which is a little bit less. But in every single state, the average salary for physical therapists is anywhere between about $80,000 to $95,000, just depending on where you live. And also in this chart, as you can see, the highest paid physical therapists are typically in nursing care and residential facilities. In terms of the job outlook, the need for physical therapists is projected to increase from about 20% from 2020 to 2030, and this is because people are aging and they have chronic arthritis, chronic diseases, and muscular atrophy, and physical therapists are needed to increase their quality of life. And also diabetes and obesity are increasing in prevalence, so physical therapists are needed here to create a good workout plan and plan of care. Thank you.